Question 21, Mr. Speaker.
Thank you, Mr. President. If I could ask the Minister for Health and Social Care if you will make a statement on the logic behind reducing the self-isolation requirement for certain key worker groups, how risk has been assessed and what justification there is for different treatments for this group.
Minister for Health and Social Care, Mr. Ashford, to reply.
Thank you, Mr. President. The testing working group within DHSC has produced a key worker pathway to support the reduction of self-isolation requirements. This pathway has been trialled in DHSC and includes a strict risk assessment that evidences the need to the individual being at work is greater than the risk of not completing a 14-day isolation period. The pathway considers a number of options, but in all cases, double testing will be required, along with strict PPE and social distancing criteria, should any exemption to 14-day self-isolation be approved by the relevant department in line with the new regulations. The pathway was also presented to Council of Ministers on Thursday, the 16th of July, and approved for wider use. The implementation, including testing and 111 pathways, is now being prepared and will be considered by Council of Ministers in 2 weeks' time. However, a start date has not yet been approved, as additional testing and swabbing resource will be required. Information will be published as soon as possible.
Supplementary, Mr. Speaker.
Thank you. Could the Minister just reiterate one point I think he said in there about ensuring that anyone who was subject to this exemption route, for want of a better expression, would have a PPE requirement put on them? And I presume that would be irrespective of whether they were social care staff, hospital staff, whether they were coming in under a Department for Enterprise exemption, they'd be required to wear masks or other purposes. So if you could confirm that. Could he also confirm what the space will be between the double testing and why he thinks that will be effective when it's not something that we're doing at the border?
Minister to reply.
Thank you, Mr. President. First of all, in relation to the PPE, yes, that's non-negotiable. PPE must be used. So hand hygiene, respiratory etiquette, even if I can say it, social distancing and a type IIR mask, which is sometimes known as the 3-ply masks, must be used while the person is at work should an exemption be required. In relation to the double testing, the tests will be taken 48 hours apart, but the other safety net, because as I think I've said many times in this Honourable Court, testing is not a fail-safe against this, is outside of the work environment with the use of PPE. It is the same situation as now. The person will not be allowed to go out into the wider community for 14 days. So if they have come over on the island and they're staying in hotel accommodation outside of the working environment, they must continue to self-isolate in that hotel accommodation, or if they are returning Manx residents, they must self-isolate at home outside of that work.
Mr. Speaker.
Thank you. So just to be clear, this isn't just for hospital staff. This applies right across the whole exemption criteria. Will the Minister confirm that those exemption criteria will be published in due course?
Yes, Mr. President, I'm happy to confirm that the full pathway will be published, and it is across the board. It will be open to the private sector as well. But as I've said, the key thing with this is that there must be proof that the person's need to work is higher than what would happen if they did need to self-isolate. So they've got to actually prove that the need for them to go into work is urgent and that they can't self-isolate for 14 days because it would cause damage either to the economy or their business or the operation of the island.